Hello, everybody, and welcome to the Valor Roundtable. My name is Mike Sullivan, and I'll be your host today. The Valor Roundtable was designed to allow EMS providers a chance to voice their opinions about current concerns and things going on in the EMS field. Before we get started today, we need to discuss that some of the topics we will be discussing are somewhat controversial. The opinions expressed by our participants do not necessarily reflect those of their employers, their friends, families, colleagues, show sponsors, their therapists, or their bartenders. In many cases, there's not a single right or correct answer to what we present. There's a lot of facts and facets that providers and administrators need to consider when looking into these topics. In short, we cannot tell you what you should think about a topic. We just hope that our presentation causes you to think. If you have any questions, comments, concerns, or other hate mail about the program, please feel free to direct it to editor@valormed.net. Now, while we've done our best to make sure everything is the most accurate and current information available, we can't guarantee that the information posted is always correct. We cannot warrant or make any representations as to the content, accuracy, or completeness of the information, text, graphics, links that we'll be presenting today. The information included is not designed to be a specific presentation for a patient and cannot guarantee that everything we present is perfect for every patient. If you have a question between the material contained here or it conflicts with your agency's policy, you need to sit down and discuss this with your training officer or your medical control director. Thank you. Today's topic will be recruiting and retention for EMS agencies. We have presenting Joe Lipschitz and Kristi Moore, paramedics with our organization, both of whom are instructors. Now, let's get going.
Hey, and welcome everybody to Valor Roundtable. Today, I'm your host, I guess you could say, not really, but Kristi Moore, and I am a paramedic / nurse / have been in this since 2001.
Ooh,
Joe,
baby.
Joe is my counterpart today. Joe, tell me your credentials.
I'm Joe Lipschitz. I've been a paramedic since Fred Flintstone slid down his dinosaur. Did it in the military, was law enforcement before that. I'm an instructor in all different kinds of certification classes, amongst other things. And we're going to get started on a few different topics here, and hopefully it makes sense, makes you think, and if not, go have a couple of drinks, because that's probably what we're going to do after this.
That is definitely true. So Joe is definitely a wealth of knowledge and has a view. He come from the earlier days of EMS, whereas I'm more of the newer, but I'm still not a, what do you call those? I'm a Gen X, not a millennial.
That's it.
So there you go, millennial. So
I guess I'm a baby boomer.
You're a baby boomer. Yeah, that's it. So what we're talking about today is employee retention and recruitment. EMS is very short right now. There's a lot of national articles out about not being able to retain getting the EMTs. They just can't retain us. Yeah. So let's talk about some of those topics. Retaining. So there's monetary and non-monetary, obviously. Yeah. Monetary, we know salaries. We need to get paid more. How many times have we said we don't get paid enough to do this?
Oh, yeah.
Right. We
That's
definitely
constant.
need more. Upping the salary, but we want to talk about the things that are non-monetary. What are things that we see working every day that helps retain people?
Job satisfaction. If you have good equipment at your job, if you're not swapping trucks 15 times because the AC goes out when it's 140 degrees outside and we're all deep frying, or you're freezing to death because the heater went out, or something stupid like routine maintenance could have prevented, your tires being bald in the rain. Things like that makes a big difference.
I agree. Absolutely. Keeping updated equipment and just having simple creature comforts. Making sure that you have a station to go back to that's not leaking when it's raining, that you have to clean up puddles of water. Like you said, the trucks, I've ran calls where I had a anaphylaxis that I'm actively dealing with and the air's not working in back of the truck, things like that. And it complicates your situations.
It sure does.
Tenfold.
I had a bad respiratory patient that we were bringing emergent back to the hospital, and the truck blew a turbo that had blew the turbo line every day for like 6 months. But yet, because of budget constraints, instead of fixing it properly, they basically bubble gum and duct taped it.
Yeah, things like that. Now, we know that there are things that you can't control.
Right.
You know, you'll have a flat tire, or you'll have mechanical issues, you know, but when it's every single shift you go in, or you learn this truck does this and this station does that, fixing those things are, you know, you want a safe and comfortable environment to work in. So, because you're getting your butt handed to you most of the time.
And there's services where their people work 12-hour shifts and post on street corners, gas stations. They're in that truck for 12 hours at a time, or longer because of volume. Or you've got crews that are on 24-hour shifts, and they're getting beat down constantly with, you know, a couple hours sleep or rest here and there. And when you have to take an hour to swap trucks, or waiting on the side of the road for a mechanic to come out, you know, or a tow truck or whatever, it really affects your morale.
Absolutely. And that is a great point to my next bullet was, you know, the call volume.
Yeah.
You know, what is an acceptable call volume for us? You know, when we go to work and you work a 24-hour shift and you're hammered with 15 calls or more in that 24-hour shift.
It's rough.
It is rough. You do not look forward to going into your next shift. So what are some things we can do to help, you know, with that? Would be putting on more trucks or reducing down to 12-hour shifts? What would be a...
Statistically, I think from the research I've seen, 12-hour shifts are a whole lot better than 24s. I mean, it's more cost for the service because they have to hire additional staffing, but you're not as safe on a 24 after you've been getting beat down for hours and hours with the call volumes. Everything from stub toe they call for an ambulance to a cardiac arrest or a multi-trauma. Your brain isn't functioning at hour 22 compared to what it is at hour 10.
I agree. I've seen reports on that myself.
Yeah, and people, you know, I can't tell you how many times over the years me and my partner have had to swap coming back from hospitals because we're falling asleep driving. Right. You know, it's just not safe.
Well, I worked 12 hours mostly through my career, and I can tell you, even working those 12 hours, I worked 12-hour day shift, and it was rough. There were days, excuse me, there were days where we would run, we would run 12 to 14 calls, including cancel calls and everything else. That's still paperwork. We would run those many, 12 to 15 calls in those shifts. Now, that wasn't every shift. We averaged 7 to 8 calls a shift. But when we would run those heavy days of 12 to 14 calls, you were exhausted.
Oh, yeah.
You didn't want to come back the next day.
Yeah.
That's part of the retention. That's part of the reason I went and got my nursing, because I said, if I'm going to get hammered, at least I can do it in a controlled environment.
Yeah.
And
there's nothing controlled with EMS.
And there is not anything controlled about. Now, I'm not saying we should go in and sleep all day and not run calls and
That'd
all
be nice.
It would be nice, but
and that's what a lot of people think we do.
Exactly, but that's not the reality of it. The reality of it is you are paid to go in and work.
Yeah.
And I understand, but when you do that day in and day out, that's where the service itself needs to take some time and go, wait a minute.
Yeah.
We either need to put more trucks on, hire more crews, and reevaluate something, because this is not working.
And people just aren't getting into this job anymore. There's nobody out there to hire anymore. And depending on your salary scale for your agency, you could be looking at a system, 30 minutes up the road that's paying $10,000 to $15,000 more with better shifts.
Right. Well, you're talking about salary now, so we can delve into that side a little bit. Yeah. Okay. There is a service I know that hires their basics at $15 an hour.
Yeah.
They still have some retention issues.
Yeah.
And so it's not strictly salary based, because they run their butts off. They run their, they have a heavy workload.
Yeah.
So systems like that where they do have a good starting salary. You know, their medics are up in the 20s.
Yeah.
And that, you know, for a medic, that's pretty good pay.
Yeah.
So
we're in the Southeast, so
right.
You know.
Exactly. For our cost of living and everything, that's where we are. So what is something, if you could speak to that service, what would you recommend for retention?
Then it's probably the call volume, and they're going to need to, you know, do something to supplement, whether it's more crews, trucks, whatever. You know, they have to evaluate the call volume. They
it's
really
a heavy.
do.
I mean, it's a heavy call volume, but they're growing so fast,
right? That they can't fund it.
Keep up. They can't keep the trucks on the road. They can't put they're putting trucks, like 2 trucks a year on the road, but they just can't keep up.
Yeah.
So
well, there's some places that I've seen that if they get on scene and it's, you know, a chronic issue like arthritis pain, they'll actually give them cab vouchers to take to the hospital, and the crew will clear up.
Right.
If it's something like, oh, I've got a paper cut, but yet I want to go to the hospital, they'll tell them, look, this isn't a medical emergency.
Yeah.
You know, I think I read it was someplace in Georgia that if they were getting on scene, and even if it was abdominal pain that's been going on for 6 months, they'd give them a cab voucher and they'd clear up their crews.
Right.
You know, instead of transporting every single person to the hospital.
That's a lot of it. You hit the nail on the head right there.
You could turn around and free up your truck, you know, for the next call, but you're also reducing the call volume to the point where, excuse me, where the crews aren't constantly beat to death. Taking that same patient that's been at the ER for 175 times in 6 months because, you know, her wig didn't fit right.
Giving them absolutely
like that.
Giving the crew some autonomy to say this is not a medical emergency.
Right.
The place I worked, the industry that I worked for, if they called, we hauled.
Yeah,
period.
That's the way it is a lot of places.
You could not say no, and if you said no, you've abandoned your patient.
Right.
There were repercussions for you.
Yep.
And you know, it was a heavy ALS load.
Yeah.
Because our patients, if they had a complaint between nose and knees, it was ALS.
Yeah.
That was our policy, nose to knees. So a toothache.
Yep.
Was an ALS call.
Yeah, and see that
sore throats,
that's rough.
ALS call. I mean, it got ridiculous, and that's a lot of people started going to other services because of that. Now I think since then the policy has changed, but there are many companies that, you know, policies are the reason that they can't retain people.
I know, and if a lot of systems have gone to tiered systems, where if they've got, say, EMD in their dispatch center, or they've got really good dispatchers that are experienced and can differentiate between I'm having chest pain because I've been coughing or chest pain because I fell down.
Yes.
Between chest pain that's cardiac related, and they'll send a BLS truck, or they'll send a BLS truck with an ALS QRV or backup truck.
Right. They do a lot of that in the upper
in the
West,
Northeast and stuff. In California, they've got paramedics on fire trucks, and they'll send a BLS truck.
Yeah.
You know, and that cuts down on medic burnout as well. Nothing to say that EMTs don't get burnout as well.
So simply restructuring and looking at how they tier the system. One thing I think personally is having a chance to advance within your system.
Yeah.
If you invest in your system, say, you know, how long have you been at your service?
I've been there 7 years, part-time and full-time.
Before that, though?
Before that, I've been there, 20, if you took all my time since the day I was hired, it was almost 27 years.
So 27 years
I mean,
on
I took
and
some
off.
time off because, you know, salaries weren't there and I had to feed a family.
Exactly. But, you know, you invest that into a service, you need to have a clear path of advancement.
Yeah.
You know, going in, especially as a new grad straight out of medic school, you want to look and say, okay, is this it? Is this the top of the line? How do I become crew chief? How do I become, captain? How do I become lieutenant? All these things. And you want to go up, 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 and up. There needs to be a clear, defined path with, salary increases. Yeah. I don't know if they do how you would tier that.
Right.
But I think...
And you can look at experience-based pays, too, because some agencies do that. Some agencies have done it and have eliminated it. but then you're not getting the experienced providers. And statistically, from the research I've read, is the average burnout for a medic is 5 years, which means I burned out 25 years ago.
Well, you probably did, Joe. I think you really did, but that's okay.
But we got to get across that, you need experienced providers to help out the new providers. They might have the book knowledge, but they don't have the field knowledge. And there's a difference between looking at a scenario in a book and looking at your patient and what happens when your monitor battery goes dead or your pulse ox battery goes dead.
Right.
They might say they're in respiratory distress, and you're looking at them and they're talking on their cell phone to their sister saying, I'm on my way to the hospital.
Right.
And there's clearly nothing that's showing they're in that distress. Or you get to the house and they're joking and smoking on the front porch.
Right.
And then they start screaming when they get to the hospital that they need oxygen.
Right. I have, and a lot of that goes into paramedic discretion.
Right.
I have seen paramedics shut a truck down because their monitor, like the little, not the monitor as far as the ALS monitor, but the blood pressure machine died.
Yeah.
Oh, we don't have electronic blood pressure.
Right.
I'm sorry. There's a manual one.
Right.
Use that.
Looking for ways to increase your company's exposure? Viking Marketing Solutions offer a broad spectrum of services to help you accomplish your goal. Professional and efficient Viking Marketing Solutions is the way to go. Give Britton a call to learn what he can do for you. There's no event too big or too small for Southern Outlaw Entertainment. Any of your music needs can be met by those who have shown their support to the EMS community. Look them up on Facebook, Southern Outlaw Entertainment. You won't be disappointed.
Welcome back, everybody. It's Kristi and Joe again. We're talking about employee retention and recruitment. One thing I want to circle back to, we made a good point before the break. I want to talk about the autonomy that medics have in the field. Being able to tell patients, this is not a medical emergency.
Yeah. It'd be nice, but we'd probably lose our jobs.
I know people are so afraid of getting sued. Yeah. Entities are so, you got George Think on speed dial, it was.
Oh, I know.
All nines, kind of thing. It's very,
and there's a plug for an insurance agency.
Right.
A joke, of course, because it's on TV.
Right.
My cousin, who is an injury lawyer, asked me one time if I thought it would be profitable for him to put billboards in an ambulance or sponsor ambulances. I said, well, if you do, I said, put them on the roof inside the back of the ambulance. That way, while they're laying on a backboard from their neck and back pain from the insurance accident, from their critical trauma incident,
right,
that they would constantly be looking at your face and phone number. And he laughed and he said, well, that is a really good idea.
Actually very
and he
genius.
Works for a major law firm as an injury lawyer.
That's the kind of problem we have in this country.
Yeah. If you call the police,
to sue anybody over anything. Now, it doesn't mean you're going to win. You can sue anything.
Oh, yeah.
But just going through the hassle and the pain and the time and attention that it takes to go through all that.
Yeah. And they'll report you to the state in a heartbeat the first time you tell them that stub toe wasn't a medical emergency. You call the police out to your house because, there's 3 cars driving up and down the road, or a family that you don't think is acceptable for your neighborhood who just moved in has guests and they're sitting out barbecuing and drinking beer on their front porch, which is totally fine. I'll sit on my front porch and drink a beer and have company over the house.
Right.
But they don't like the people who are there. They keep calling the police out there, and finally the deputies or police are going, you call me again, I'm going to lock you up for being a public nuisance or abuse of 911.
Right.
We get the same patient who calls us 170 times because basically she just wants to get out of her house.
Right, and they have a, quote, medical complaint.
Right, which could be anything from an ant bite to indigestion.
Right, or a toenail, ingrown toenail kind of thing. Or
stuff that a family doc could take care of, or an urgent care. And they've got 5 or 6 cars, and they've got their whole family there, and the family is just like, I'm tired of it. Just take them to the hospital. I'm not driving them.
Right.
Now, there are true emergencies where you get there and it's the same person who's actually having a medical emergency at this time.
But by then they've cried wolf so many times, and you know them by name, you know their history, you almost darn near know their date of birth and social by heart. That's how many times you've picked them up. But they are having a medical emergency, and guess what? You miss it because you just BLS it and go on.
Yeah.
Oh, they've had the same tooth pain or whatever, and turns out being a big MI or whatever. But
same headache, and they're having a bleed this time.
Yes.
Because granddad got sick of listening to him and smacked him in the head with a pot.
Something, I mean, something. It's always, and those are the discerning times where you have to say, wait a minute, I've picked up this person so many times, this is different.
Yeah.
Paramedic discretion. That's where they need to rely on us as paramedics and our ability to assess.
Yeah.
If you've picked up the same person on the side of the street drunk and they've never had a seizure before, but now they're having seizures, okay, there's something different.
Right.
Like you said, the bleed, they might be slurring their speech or something might be a little different. They might be compliant this time, whereas normally they're just belligerent and they cuss you and they just want to get in the back of the truck and go. Something is different. That's where you have to use your EMS judgment.
Every Friday and Saturday night, years ago, I used to pick up the same guy laying on either in the street or on the curb in front of his house. His neighbors got to the point they would pick him up out of his street, move him to the sidewalk, and call EMS. We'd get there. We had to take him to the hospital. Now, he was a little inebriated all the time.
Right.
But he would leave the ER, walk out the back door of the hospital, across the street to the convenience store, buy a 12-pack, and walk next door to his friend's house. Every Friday or Saturday night when a crew would go pick him up. Now, you can't tell me that's not abuse of EMS because the guy didn't have a car or a moped these days.
Right.
And couldn't go to the liquor store.
Right. So
and that contributes to your burnout in EMS.
Absolutely. That's what I was going to say.
You can't retain people who are constantly stifled, from Archie Bunker, stifled on what they say because they're afraid of losing their jobs or getting sued and all that. People, look,
and your service will not back you.
No.
If you tell a patient they cannot go to the hospital, your service will not back you. You are on your own.
Right.
Period.
Because the administrators are in the same position. They've got bosses to answer to, whether it's county officials, whether it's CEOs, if they're a private service.
Right.
Everybody's got somebody to answer to.
Right. Well, it's a business, too.
Yeah.
And the business side of it is you don't get paid for refusals.
Right.
You get paid for transports.
Right.
Now, here's the thing. Who's paying this bill?
Tax people most of the time.
Right. These frequent flyers, if they have Medicare, Medicaid, Medicare only pays if they get transported. Yeah. Medicaid will pay for emergent transports. Yeah. Then you've got this problem with how are they getting home kind of stuff. Yeah. So it's kind of it clogs the whole system.
Oh, it does.
And we see it. And ER nurses, ER docs, everything, they see it.
Yeah.
The general public does not see it.
Right.
And I don't know if bringing attention to that kind of thing will help more with retention, or if...
Well, you get the ones, too, like Live PD and whatever the one is, Live Rescue or something like that, First Responders Live, whatever it is, or the show they had in New Orleans. You've got all these EMS and law enforcement and fire shows on TV. Some are actually live, broadcast, reality shows. Then you've got the ones that are made up.
That glorify it, and it's really not. If you're getting this for glory, it is the wrong field.
But the reality ones, it might take them 6 months to get actual good calls, what we term good calls, structure fires, drug busts, warrant arrests, things like that. But they're so rare, between 90 and 99% of the calls we run are non-emergency calls.
Where do you think we crossed over from? I know growing up, we did not call EMS. I don't ever remember EMS being called to my house, to my neighborhood. I never saw an ambulance except on TV.
Right.
My parents didn't.
Oh, yeah.
They were just, if I had appendicitis, we went to the doctor.
Right.
It was just, you went to your family doctor, your PCP. When did we cross over to everybody call 911?
Oh, I know. I remember the doctor coming and visit my grandmother at the house. Granted,
Yeah.
I'm a little older, but
now that Joe, that's way back.
you know,
That goes
but that's
back to
when the
that.
milkman would deliver our milk to
Yeah.
milk and cheese and butter and, you know.
Yeah.
But it seems like probably the mid to late 90s, it got even worse. You know, people will call 911, whether it's to have the police come out and discipline their 8-year-old because the kid talked back, or they've got a cold for a week and they want to go to the hospital. I mean, I don't know what it changed. I think part of it might be the culture of the people. You know, they just want to go someplace because a lot of big hospital systems buy out family doctor practices.
Right. That's true.
And, you know, these doctors, they have to say they've got 1,000 patients, you know, in their practice. They might have 20 doctors, but it breaks down that they've got 5 minutes per patient.
Right.
And they've got push 1 to speak to the nurse, push 2 to schedule an appointment. People get tired of that,
Right.
you know, which affects us in EMS because we get there and we can't say, well, you could go to your family doctor. You can go to an urgent care. This isn't a medical emergency. We're constantly biting our tongues, which causes us to burn out because we've got the moral problem there that why are we doing this? We're lying to these people, basically.
Right. However, now you brought up a good point about urgent cares.
Yeah.
We pick up people from urgent cares.
Oh, yeah, we do.
Take to major hospitals because of chest pain or something of the sorts.
Yeah.
I wonder if we could start transporting to urgent cares. I wonder how that would work out. I wonder if that would even be possible.
I don't know. Because, I mean, they are doctors. It technically is a medical facility.
I mean, we do a triage system in the hospital. I wonder why we couldn't adopt a similar triage system. And as we dub patients 4s and 5s, they go to urgent care instead of clogging up our level 1 trauma centers.
Yeah.
Now,
I have seen a system that has a nurse line. They dial 911. The dispatcher says, well, this doesn't sound like an emergency. And they transfer the call to the nurse line. An RN evaluates the patient, and then she'll call whether it's a private service or she'll call and say, no, this is a medical emergency and needs, you know, an ambulance.
Right.
You know, I don't know what the nurse line does or if they say, hey, you're full of crap, you know, call your family doctor.
Right.
But, you know, they do have that option, I'm sure.
Yeah. We focused heavily on the burnout part of it and why we get burnout. One of the things I want to touch on is, you know, we talked about the different generations. You're a baby boomer, I'm a Gen X, and now we have millennials. When I, in 2000, started in EMS, you had to have tough skin.
Yeah.
And you did something wrong, you were told so.
And you had it harder than I did because you're a female.
Right.
And they look at women going, oh, she can't do this. She can't pick up the stretches. She can't.
Right.
You know.
Females were not very prominent. They were growing.
Right.
And since then, we've grown substantially, you know, as a lot. I don't know what the statistic is in it, but now, I mean, we have all female crews. I mean, it's a big deal now. However, you know, I had some pretty tough skin and there was no lateral violence kind of thing. It was you toted your butt whooping or your butt chewing or whatever it was, and you went on about your business. Nowadays, you can't do that. You have to hold hands and sing Kumbaya. You know, if you talk inappropriately or down to your partner, you're in the office.
Oh, yeah.
You know, it's...
and EMS, you know, just like any emergency services, it's a whole different breed of people. We cut up something fierce.
Right. So
you know, because we're family. We spend basically a third of your life with your partner or, you know, your shift of people.
Right.
And things aren't the same as they were when I started in it. You know, it used to be you'd go out and you'd have drinks with your shift, you'd have breakfast, you know, you'd do this, you'd do that. You know, you'd have a barbecue at your house, and 99% of the people there were your shift and their spouses.
Right. Well,
you know, now people don't even really do anything with people they work with. They come in, they collect a check, and they go to the house. Right.
There's no investment.
Right.
And that's what we were getting to
earlier. And a lot of the management will put you down for as a manager, a shift manager, for being too close to your shift, for giving them that person outside of work that. If you're having a problem with your spouse, You know, you could talk to your boss, you know, your friend who actually happens to be your boss. Some systems put that down. They don't want that intermingling.
Right.
You know, you might be the boss at work. Don't talk to them at off duty.
Right.
You know, you have a shift Christmas party. You're the one sitting there not having a beer because everybody else is.
Right.
You know, I mean, it's wrong. Mm-hmm. You know, you want the camaraderie because these people spend the time, you know, a third of their life or more with these people.
Right. And according to, you know, a lot of the popular sites such as EMS One and EMS World and all these, that's one of the things they recommend is getting to know your shift.
Yeah.
Doing things outside of your shift with your coworkers to strengthen that cohesiveness so that you do have each other's back a little more. Yeah. However, that also opens the door to
relationships
nepotism and things like all that. So,
I mean, you know, you've heard it for many years. What does EMS stand for?
Yes, we earn money sleeping.
Yeah, or
that's the one we're going to go with.
Okay,
Joe, earn money sleeping.
Yeah, I mean, it's crazy. It's not how it is,
right?
You know, and I mean, everybody's got a job to do, but when you start treating your people basically like numbers, you know, when you look at your experienced people, but because you have to get butts in the seats,
right?
You hire people who don't have the experience. They don't have the team support from the agency. They don't have all this stuff that affects your retention.
Right. Well, I was reading a statistic that an employee usually stays 180 days.
Yeah.
After 180 days, they either start looking for a new job, or they've decided they like this job and they'll stay for mostly no longer than a year.
Yeah.
Until it no longer benefits them to stay there.
Right.
So all these things we have talked about is things that you can help that investment into it.
And it is an investment because look at your training costs between uniforms. If your agency provides uniforms, everything from boots to shirts to jackets, turnout gear, all that stuff, you're looking at thousands of dollars you're investing, plus the time you're training with an FTO or whatever, this new employee. You know, you could be looking at $40,000 worth of an investment on a new employee.
Right.
You know, and if they come in and they see that the director, the assistant director, the training officers, the captains, all this are more about themselves. They don't communicate anything about the system. Mm-hmm. They don't really give a rip about what's going on with the system other than covering their butts.
Right.
You know, we've both been, all of us, including our sound and technical advisor, have been around for a day or two, and we've seen good agencies falter because of management.
Absolutely.
You know, and if you keep your people happy, even with small stuff. I had a director one time, and he was a pretty darn good guy. You could go into his office, say, "Boss, I got to talk to you for a second." And he'd say, "All right, push the door closed," or is it an open door type discussion? And you'd say, "No, I just want to push the door closed, and I just want a few minutes to vent." And you could let it fly. Mm-hmm. And he would turn around and say, you know, give you whatever his opinion was, and you'd feel better. Now, you can't do that.
No. Because
everything is documented somewhere.
Yes. Anything and everything you say can and will be
used
twisted and used against you at some point.
Oh, exactly.
Absolutely.
And that's no way to retain people.
Right.
If they've got somebody that yesterday they were out drinking a beer at their pool, and they come in and they say, "Look, I just found out my wife's cheating on me. You know, that's why my mind hasn't been on my job today." You know, they're talking to you as a friend, not as a boss.
Right.
You know, and I'm not going to sit down and say, "I spoke to so-and-so," and typing up, you know, just notes that I spoke to so-and-so and their job performance is lacking because of personal issues.
Right.
You know, everybody's got baggage.
Right. So you're saying a lot of it is, you know, developing those relationships and being able to have those off-duty, if you will, conversations.
Oh, yeah. Even if it's in the office, it doesn't matter, because you know that if you came to me or I came to you and said, "Look, this is what's going on," you know, so if I don't seem like myself, this is what's going on.
Right.
You know, And if I need a kick in the tail, I'll be the first one to admit if I've had a problem or, say I backed a truck into a pole. A lot of people won't report that stuff, but I'll be like, hey, boss, you ain't going to believe this stuff.
Right.
My spotter turned to look at something.
Right. So not being afraid to tell the truth.
Right.
Without repercussions.
Right.
That is a huge part of it right there.
And
not
people are scared
afraid
of that these days.
Yeah.
I know an agency that, being a paramedic, you could pretty much get by with running over every pedestrian in town. And as an EMT, you'll be suspended for sideswiping something or hitting a mailbox or getting a flat on the truck because you drove through a ditch, popped a curb, stuff like that. Stuff that happens, just because it does.
Right.
But an EMT will get suspended because of it, where a paramedic won't.
Right.
You've got to be across the board, and that affects your retention.
Right. Unanimous. It's got to be across the board, like you said. If there are problems, dealing with them, if it's an individual, dealing with that individual. Do not shotgun that. If you have a paramedic who missed an MI because they didn't ALS a tooth pain, don't make every tooth pain an ALS call.
Right.
You deal with that particular person in that particular situation, not shotgunning it, not being afraid to tell people, I'm sorry, as a training officer, this was wrong.
Oh, yeah.
We need to correct this. Do we need more training? What do we need to help you?
You don't write a policy because one person talked on their cell phone that nobody can use a cell phone.
Exactly.
That's the one time where you say you have to call dispatch for something. Well, I can't call dispatch after they requested a phone call because there's a policy in place that says you have to use this specific phone. You can't use any personal communication devices. Well, I can't get a signal on this phone, but I can on mine.
Right.
But you can't use it because of policy and you're afraid of losing your job.
Right.
That affects your retention.
Yeah, that's a great point there. And that might
blanket
segue
policies just...
Right. I think that might segue into our next conversation. Maybe we could talk about using personal devices and electronics on the truck, and we could, kind of segue into that, if you will. So, anything else you would like to add or to our conversation before we wrap things up?
Just basically, to retain good people, you have to treat them with respect.
Agreed.
You can't treat everybody either bad, good, or indifferent. You have to be able to respect your crews.
Right. Absolutely.
Whether they're the director down, you might have a director that you respect him just because he's the director, not because he's who he is. But you have to respect the position. Same thing with captains, FTOs, paramedics, EMTs, whoever. It's all about respecting the people.
I agree with that. Very well said. Well, thank you very much for joining us here at the Valor Roundtable, and that concludes our policy and retention, or our retention and recruitment segment here, and have a good day.